Good afternoon, everyone, and welcome to today's Black Health Trust. I would like to turn our meeting over to our founder, Dr. Randall Maxey.
Thank you very much, Dr. Walsh. I appreciate you very much. And our other two moderators, Dr. Neighbor Stevens and Dr. Hind, I think are both traveling. But we have a very interesting show today, and I'll be happy to talk about that in just a moment. But I had an earlier conversation with one of our frequent guests, Admiral David Brewer. The Admiral retired a few years ago as a three-star admiral or vice admiral. I think the highest you can go is a four-star, but he was a three-star vice admiral. And I was talking to him about the conflict in the Middle East that has the potential of dragging us into a larger world war. But he assured me that that probably will not happen. And he was telling me that if Iran sent more than 300 or 400 missiles or drones into a certain country, that only 2 or 3 of those got through is because we have a system called the Aegis. And it stopped everything from coming there. The reason I brought this up, I happened to go to an event celebrating the integration of Black men and women into the armed forces. And there were 5 Black flag officers on the stage, and I was so proud of these gentlemen. And he's agreed to come on our program again in a few weeks and just talk about African Americans in the U.S. military. So we're going to welcome him. But today, in honor of Dr. Walks, we're going to have a program on the healthcare of seniors. Is that okay, Dr. Walks? Or that me?
As a veteran of the United States Air Force and a senior, I'm more than happy. Go ahead, Dr. Maxey.
Very good. Well, our speaker today is Dr. Adrienne Burroughs. She is a physician who is in private practice in internal medicine. She's been practicing medicine for more than 20 years in the Los Angeles area. She went to a very good medical school, maybe the best, called Howard University. And then she went to USC and she did her internship at Huntington Memorial Hospital. She's been practicing for those years, and she does a combination of integrated medicine, internal medicine, and she specializes in seniors. And she also does some medicine that we call regenerative medicine in terms of making people look and feel better. And so I'm very excited to have Dr. Adrienne Burroughs speak to us. Dr. Burroughs, you have the floor. Simon, can you start with the first 2 slides?
Thank you, Dr. Maxey, by the way, for such a lovely introduction.
Go ahead go show her. I want to see her picture. And then you can go to her slides after that.
Thank you, and I'll start there. So I always put this character on the screen. I don't know if you guys are seeing, it should be a picture of a cartoon character, Buzz Lightyear from the Toy Story franchise.
Yes.
you may see the picture soon, but for any of you that had kids or grandkids or just felt like a kid, you know, in the past couple of decades, maybe you have seen some of the Toy Story movies. And this character was the ever optimistic, looking on the bright side, superhero Buzz Lightyear. And his catchphrase, you know, that he would say over and over again is to infinity and beyond. And I use that quite often in my own practice when I'm dealing with my patients, in particular my seniors, and they want to, you know, ask, well, how long am I going to be around, doc? Or how healthy can you make me? And I want to inspire in them that I want them to be around to infinity and beyond. Next slide. And that's just a picture of me. We can go on to the next slide. Okay. Now, also for some of you that are older than 10 years old, you may recognize this gentleman, Mr. Dick, the late Dick Clark. And I put his picture up here because I grew up every year, and I still do, it's sort of almost in honor of him, and watching the ball drop on New Year's Eve. But New Year's Eve was synonymous with watching the Dick Clark Rockin' Eve show. And one of the things my family and most people I know always reveled over was, my gosh, does this guy ever age? I mean, you know, he went from American Bandstand and New Year, I mean, just year after year after year after year, you know, he seemed to have the vigor and the spirit and even the looks that just were timeless and ageless. So I always think of Mr. Dick Clark, and, you know, and he was doing this probably without some of the augmentation options that we have today. We're going to the next slide. So how do we do this in the new millennium? Well, let's talk a little bit about aging in the 21st century. And this is a wonderfully dynamic time and period for medicine, for what we call aesthetics or integrative or regenerative, or, you know, all of these things coalesce at this period in time in a wonderfully magical and symbiotic way. So let's go into the next slide. Okay, so let's start off with when we're talking to patients or clients, depending on how you like to refer to the individual or yourself, we talk about that nowadays there's a healthcare team. Once upon a time, there used to be an old show, Dr. Marcus Welby, where he was kind of the doctor and he told the patient what to do, and the patient listened yes or no, and, you know, and it was sort of this paternalistic relationship. These days, the patient or the client and their provider are all part of a healthcare team, you know, and that team, of course, has the captain, which if it's pertaining to you, the patient, you know, that is you. You know, you're in charge. You're in charge of your destiny. You're in charge of the options that are available to you and whether you utilize them or not. But you are an integral part of that team, and your participation is vital. Now, it gets very confusing in these days because with HMOs and managed care and different types of insurance and covered California and gosh knows the on and on myriad descriptions of how we attain our health care, it gets confusing. Well, what are the roles of all these different persons? So we already identified that the patient is the captain. That's the person that is in charge. And I recommend, of course, I may be a little bit biased being a primary care physician, which is abbreviated PCP, but I think we're also an important part of that team too. Not as important as the patient, but pretty important. So I'll call us the quarterback. Okay. So now a lot of people sometimes, even in my own family, sort of try to bypass the quarterback position because they feel like, well, that's just one extra person I got to go to. I can call my cardiologist. I can call my, you know, my heart surgeon and stuff. But it's important to have a person that's kind of the owner or the one that can kind of encapsulate all of these different things for you, that can help these things interconnect, because your specialists, well, they're very busy and they're also looking at things many times from their point of view, as opposed to the holistic point of view. So having a primary care physician, which is what we are called these days, not to be confused with once upon a time, people might have said, oh, I have my general practitioner or my GP, is typically something that you want to have as part of your team and that you, the captain, want to have a close relationship with. Now, the other key players on your team, those are all the persons, if this is a game, whatever your sport is, that is important in helping you reach that goal. So that may be other specialists, that may be your family, that may be your neighbor, that may be your pharmacist. There's a infinite number of persons that can be part of your team at any given period of time. Next slide. Okay, so I believe we also have on the call a wonderful Dr. Jesse Sherrod, and many years ago I felt like we pioneered, touting this to the public, letting them know this catchphrase, know your numbers. Okay, and what does that mean? That means that as part of your healthcare team, unfortunately or fortunately, there comes a little bit of responsibility. So some of the things that a patient, any person, if within their wherewithal, should try to know and remember are at the very minimum these three things. Something called your BMI, which is your basic or basal metabolic index. And that's a calculation that sort of plugs in your height and your weight and gives us a number by which your medical providers can communicate, the status of your weight as healthy or unhealthy, obese, overweight, or non-obese in an objective manner. So it's not about how good we think you look, or we think you look chubby, or we think you look skinny. We can all talk in terms of BMI and know that we're talking about the same things. Now, the next thing is your hemoglobin A1C. You may see it on commercials, or, it's important to just remember the last three parts, which is A1C. Do you know your A1C? That first word, hemoglobin, is not to be confused with hemoglobin as in your blood count. The hemoglobin A1C is what pertains to your blood sugar, and it is a more accurate description of whether or not a person actually has diabetes or is pre-diabetic than checking your blood sugar or your glucose at any one moment in time. Your hemoglobin A1C is reflective of the average of your glucose over 3 months. So you can't cheat before you go to the doctor. You can't eat a salad the day before and say I have good numbers, or you can't blame it on the donut you ate night before last. The hemoglobin A1C really lets us know the truth about how your blood sugars are doing in your body. And just so that you know, we want your hemoglobin A1C to be less than 5.7. Okay. And then your cholesterol. Now, cholesterol can be a little bit tricky because there's several values that are reported in cholesterol. And depending on the doctor that you're going to, they may check certain types of panels that list some or all or different aspects of the cholesterol. So it can be sometimes challenging to communicate your cholesterol from person to person. But at the very least, you might want to know what your total cholesterol is, what your LDL, low density lipoprotein, also known as your bad cholesterol, and something called your cholesterol ratio. Now, a question patients may ask me is, well, what is bad cholesterol? And unfortunately, I like to say, well, you know it when you have it because it's delicious, right? So if it's yummy, if it's oily, if it's making you go, that's so delicious, like those fries and that pizza and that ice cream, yeah, that's probably the bad cholesterol. So you just don't have to think too hard about it because it's usually putting a smile on your face. All righty. So we just want to make sure that we know those numbers so that we can always be cognizant of how to modify and optimize those numbers. And just so for the record, we want your total cholesterol to be approximately less than 200 in most persons. We want your LDL to be approximately less than 100 in most persons. And cholesterol ratio, there's a couple of different types, and it's specific to your sex and your age. So that may vary depending from person to person, but usually 3.2 is a good number, is a good basic number. Okay, next slide, please. All righty. Still talking about this captain, this member of the healthcare team, some of the other responsibilities that would go very far for you, whether we like it or not. And that is, you still want to get those regular annual examinations. Everyone goes to Google and we can look up how we feel. And believe it or not, I go to Google myself, but nothing is going to replace you, the captain, meeting with your doctors, particularly your primary care doctor, at least once a year. And when you go, us doctors would love, love, love if you know what medications you're taking. So you can bring in a list of your medications, or what I even like in my office is, hey, just throw them all in a bag, just go to your medicine cabinet and just for that one day, throw them all in a grocery bag and bring them in so that I can go over them with you and we can make sure that what you're taking is reflective of what's in the charts. Many times patients will come in and say, hey, doc, it's in the chart, you got it. But guess what? You've gone to other doctors in the emergency room and this or that, or grandma forgot to put something down 3 years ago, and the nice little medical assistant says, hey, is it all the same? And some misinformation gets transferred visit after visit after visit. So at least on that annual exam, bring in the medications so that, you know, what you are taking is actually what is reflected and can be addressed. Now, some of you who have been to the doctors in the past few years may have heard terminologies like, hey, but it's on my MyChart. I saw my sister's MyChart. Well, MyChart is a product that a lot of large hospital systems and even some doctors use as your medical portal. If you have access to a MyChart, I highly encourage, once again, like it or not, that you get familiar with it, because these days that is becoming more the trend of how to store and communicate your medical records. And they really are now putting that onus more on the patient than on doctor to doctor as it was previously. And lots of things will be coming to you from your MyChart or from your doctor or from their staff via email or text messaging. So we do have to get familiar with some of these more modern ways of communicating our health, considerations. Next slide. Okay, so let's talk about where we've been and where we are now. I always like to point out that things are improving. Like sometimes it seems like from day to day, year to year, voting cycle to voting cycle, are things really even changing? And I put up some data here from 1970 to 2020 just to show you that, our life expectancy, these are the reported life expectancies for those years, have changed. If you see there on the left, it shows that back in 1970, doesn't seem like that long ago, maybe for some of us, the average expectancy of life of a Black man was only 60 years old. These days, a 60-year-old Black man just seems like a kid, right? Like if someone passed away at 60 years old, you say, oh my God, they left here too soon, and to see now in 2020, that the life expectancy for Black men is 72 years old. And I would like to put an asterisk by that to also say that, that data is probably even outdated, is probably even higher today. And you're also going to see higher numbers in the communities that are probably more affluent, more educated, in those expectancies being even higher. But nonetheless, we have improved in our life expectancy. It's wonderful to see that even in 2020, women, our average life expectancy has now exceeded 80 years old. And that's the average, and what I see in my own practice is much, much higher than even these numbers. Next slide. Okay, and well, let's talk about what makes us go away sooner than we want to go away. Well, in all cases, men, women, all races, Black, we see that heart disease and cancer are topping the list of, what people pass away from the most. So that goes back to like knowing those cholesterol numbers, knowing that hemoglobin A1C. These are some of your predominant risk factors for heart disease. And then cancer, certainly we want to try to prevent cancer as best as we can, and we want to detect cancer as early as we can. Next slide. So when we talk about detecting cancer, and this is us going to see our doctor once a year in case we don't want to remember all of this stuff ourselves, that's what you pay us for, is that we want to start getting our screenings. And these are just some highlights of some of the more updated screening recommendations. So for breast cancer, I hope all of us women, especially Black women, are starting to get their mammograms by no later than age 40. And that is every year. Okay. And where it says stop there at age 65, I would put an asterisk by that, because if you really look at the details of most data, that's also based off a discussion with you and your doctor. Because if you're thriving at age 75, in my own practice, I continue those breast cancer screenings to longer than that age, depending on how well the person is doing overall. Similarly, alert, alert, alert. Colon cancer screening starts at age 45. So all of you that last week thought it was 50, nope, it's age 45. So if you were waiting around to get to be 50, you're already 5 years too late. And for prostate cancer, you know, you want to start at age 40, especially in the Black male community. You know, many of you may have heard that this guy we once heard of named O.J. Simpson just passed away a few days ago, and he passed away from prostate cancer. And that's just one example of how prevalent and predominant prostate cancer is in the Black male community. There's some new changes with cervical cancer screening. Now it starts at age 25, so that's a bit later than we thought it was previously. So those of you still working on like 21 or 18, that's outdated. Now we don't have to start our cervical cancer screening until age 25. And we actually can stop that earlier. We could stop that at 65. Lung cancer, we don't screen everyone for lung cancer. We do, however, recommend screenings for our smokers. Next slide. So those are ways we can stay healthy from the inside. Now let's talk a little bit about ways we want to feel good from the outside. Next slide. Many of us, I hope, recognize this wonderfully gorgeous, spirited and looking young lady, especially some of our male viewers. Her name is Miss Halle Berry. And I wrote the word still because she was once upon a time synonymous with beauty, not just in the Black community, but in the world over, and she still is. Next slide. This slide here, you will see it's a slide with a lot of different pictures. I don't expect you to zoom in and look at all of those different pictures that'll be coming up shortly that says Zoom boomers. And if you aren't seeing that, it's just to let you know that right now there's a trend going on called Zoom boomers. And what that means is that in the past few years with the COVID pandemic, the world has shifted as we are doing today, where we're doing a lot of things via Zoom as opposed to in person. But people are now on Zoom and recognizing that when their close-ups are zoomed in, that they have blemishes or that they don't look as spry as they would like to have looked and stuff. So people, when they get off their Zoom camera, are running into their doctor's offices and other places to say, hey, you need to make me look a little bit better by the time I do that next Zoom call. Okay, so this is a whole phenom that everyone is trying to look better because of the Zoom effect, because we are recognizing, you know, it's like looking in the mirror, but looking in the mirror in a public setting. Go ahead to the next slide. Okay. And just to, you know, this value, if you see the slide here, I wrote the money spent on treatments to look younger. Now, we can play with this statistic in many different ways. And if you see here, I have written 10 billion, but that is a very, very small estimate of really what this market is. This market is actually in the triple digits of billions in terms of what is spent on skin treatment. So depending on how you couch the search, but 10 billion is on the shy end. And just to go into that a little bit more deeply, you know, how much are people spending on trying to look younger? Well, even just to put in $500 a year, you see back in 2000, 20% of people, you know, over 50, that's quite a large number. That's one fifth of persons over 50 were already spending over $500 a year, you know, on things to make themselves look younger. And now in 2022, you see that number is approaching 50% of people are spending over $500 a year. Now, people fuss and grumble at my medical practice because of the parking that they may pay $10 to $15 to come for their medical appointments, which may be to discuss their heart or their cancer or any other number of things to help them stay healthy or alive. But we are spending over $500 a year on ways to look younger if we want to kind of, you know, gauge where person's mindsets are, you know, but that's not exactly unwarranted, you know, because feeling good on the outside does have positive benefits in how we feel overall. Let's go ahead to the next slide. Okay. So as I just mentioned, when we look good, we do feel good, I mean, and there's been data over and over for over the years that when people get their smiles fixed with their dentist and stuff, that they start to feel more confident and they start to become more social, and those social interactions bring them, I mean, it helps raise the endorphins. It just helps improve their overall health. So something as simple as fixing your smile actually makes you healthier, and that can be extrapolated upon in many, many different ways. And certainly we know that exercise is good for our health. Exercise is good for our heart. Exercise reduces the all-cause mortality. Exercise reduces the risk of cancer, but exercise makes us look good too. So, regular exercise, is also good for helping us to age well, both inside and outside. And, I don't know what type of audience, hopefully it's not a G audience that we're talking to mostly, but, I was going to put up a slide of a young lady that's no longer with us, also named Suzanne Summers. And, Suzanne Summers was famous for the show Three's Company, but, she also was a workout queen and had videos on exercise and stuff. But as she got older, she publicly said that the true key to good health was to have sex, and that she made a point of having sex every day for her health. So I don't know if any of us can keep up, to that standard, but, regular sexual health is definitely recommended as well. And I say this to patients in my practice, and some patients will say, well, I'm single, I'm not in a relationship. And once again, I don't know the audience we're talking to, but, sex does not have to be with another person. So, we can also, enjoy sexual relations with ourselves, but there's also this thing, if you don't use it, you lose it. Well, that is true, because we have certain hormones in our bodies and stuff that are only excreted during the experience of sexual pleasure. And those things actually have positive physical, impacts on our overall health. Down here, it is Sunday, and, we talk about fellowship. Fellowship could be in the form of religion. It can be in the form of hanging out. It can be in the form of calling a friend, a neighbor, but, having relationships with other persons. And it's important to highlight this at this time, because we are living in an age where, with the pandemic and Zoom and social media and stuff, that we forget to have human to human contact and interactions and stuff. And it's important to try to reincorporate, if we have not been, or to continue to incorporate, those types of experiences for us, because those things help keep us healthy as well as keep us young. And then we'll talk more about, how we can do some things, some fun, cool things to, augment the aging process by working on our skin and our body, such as skin care and body contouring, if you haven't started hearing these terms float around in your, circles that you run in. Next slide. Okay. So I put some names in here. My son's gonna kill me, but here this slide is kind of busy, but it talks about skin. So one of the first things, with our skin, and once again, if we looked at the numbers of what people spend on skin products, the numbers are in the triple digits in terms of billions. But, a basic good skincare routine with cleaning your skin and moisturizing your skin. I'm sexist, I admit, but sometimes I have to remind my male folk that, using a daily moisturizer is actually not just good for how they look and how their skin feels, but it makes it more resilient as well. And I put up your example, Gage and Jacob. This is my son and friend's grandson, and they're two teenage boys. One's on a basketball team and one's on a football team. And I'm talking to a friend, and she's telling me the story about how she's fussing at her grandson, Gage, a high school football player, to take out the trash, and he was not. He's a teenage boy. So she goes into his room to expect he's in there on his video game. And no, turned out he was in there with his face mask, saying that he was working on his, on his facial routine. and that he'd get to the trash when he was done. And my son Jacob just got his own little bank account card or something, and the first thing I see purchased in the mail that he's purchased for himself is some things to prevent wrinkles in his eyes, so that when he gets his new contacts, he won't have dark circles under his eyes. So, we joke, but this trend of wanting to look healthy and stay young has, expanded into every arena that we can imagine. And including our washing and our moisturizer, we want to remember sunscreen SPF 50 or greater. And I like to remind our persons of color that includes us too, because we sometimes don't use sunscreen if we don't feel sunburn, so we don't think we need it, but we are still susceptible to the negative impacts of UV rays. So even if we're darker skinned and we may not feel sunburn, we too should be using a daily sunscreen. My next line down there, I have the poor plastic surgeons. And what I mean by that is that, in this day and age, people are acquiring treatments for their skin and their wrinkles all over the place. So now you don't necessarily have to run to the plastic surgeon to have facelift, right? You can get treatments in a variety of different medical settings. I get my face treatment stuff at my ophthalmologist. Believe it or not, a lot of the gynecologists are in the skin game. So you go for your pap and you get your face tuned up while you're there too. So you do see a lot of opportunities to, to work on your appearance in a myriad of different settings that don't have to be necessarily at the high price point of, surgical procedures with our plastic surgeons. And some of those treatments include, things like PRP, which has been around for some time. PRP stands for platelet-rich plasma. So that's where we take your own blood and its healing and regenerative factors, and we put it back into your own body in a variety of different treatment ways to help. But wrinkles is just one of those things. And most persons have heard of Botox. Botox is like saying Xerox. It's the most common brand of neurotoxin, but there are competitors to Botox injections as well. And fillers, people want their lips plumped up or want some sunken, cheeks filled out. So that too has been being used widespread and is becoming more and more commonplace across the races and the ages and the sexes. Microneedling has been around for some time, and it can be used alone or in combination with your blood, like the PRP, in combination with laser devices such as radio frequency that I have listed there. And I don't know if that link will come out if you copied it, but it was an article just giving you more detail on what radio frequency or RF is, but I can also, if time permits, talk to you a little bit about it. But I'll group radio frequency kind of in the category of laser treatments. And these laser radio frequency treatments, as I mentioned previously, are available very widespread now, and not just at some of your higher end specialist office, but I offer them at my own office, and so do several of my colleagues across the city. And the good thing is that, these are not cookie cutter approaches. People can mix it up based off of how soon they want to expect results, what they want to expect exactly, the downtime, et cetera. So it really can be tailored to an individual's desire and need. Next slide. And as well as your skin, in your body, some of us want to, also look good from the from the neck down. And I put up here, fake it till you make it. So we've been doing that since the beginning of time, right? So even as far back as the in the Renaissance and the royal days, ladies were wearing corsets, and in the early 1900s and 20th century, women, became popularized wearing girdles. You ask my kids now what a girdle is, they'll have no idea what I'm talking about, but in the, in the new millennium, the latter part of the 20th century, women tossed their girdles and they started wearing Spanx. And these days, it's not just Spanx for women, but there's Spanx for women and men. Next slide. But these days, people are even ditching external garments altogether because they want to wear their swimsuits and they want to be out and about, and they're doing these body contouring treatments. So some of these treatments can be done in conjunction, once again, as I mentioned, with like PRP or alone. You may have heard of like Cool Sculpt, which uses a very cold temperature to augment the fat or the muscles, but they could do it with warm temperatures. There's things that target at the skin layer or at the fat layer or at the muscle layer or at maybe different combinations depending on which device or devices you're using. And these are typically laser or radio frequency type devices. Next slide. And just, quickly, just to note that these bodies, what's beneficial about these new body sculpting treatments is that there's no downtime, and you can go in, you can have a treatment done, for lunch, and you can go back home, or go out to dinner that night and not have to, escape from people for days or weeks at a time as you recover. Next slide. Once again, you can mix things up. Radio frequency, it may sound scary to some persons, but it is one of my favorite things that has come about. And for the doctors on the call, I'm really excited because I've had my radio frequency device now about 5 years for the purpose of aesthetic treatments. But as I continue to go to more and more lectures and conferences, we're really realizing the utility of radio frequency, not just in the aesthetic realm, but also in the medical treatment realm. So now we're able to treat back pain and some eye injuries and some of these other things simultaneously or with the same devices using radio frequency. And radio frequency is wonderful because it's very user friendly. The device that I use in my office, TempSure, is highly, the device itself cannot allow you to burn people or to overtreat people. And it is using the person's own body, because what it does is stimulating, their collagen and elastin to produce in their own body without giving them something external. So I really love radio frequency and all the different modalities and opportunities we can use with those types of devices. Next slide. Okay. And this is too busy for you to read, but it just basically says, how do you know which device is best for you? Everybody kind of, once again, goes to Google, and it's, and there's a lot of different ones out there. There's different new ones that come out every day. If you talk to your provider or whomever's you're looking to have do this for you, make sure that, you get a good sense that there's someone that you can trust that is not just telling you what they offer, but also telling you what technology is out there that's available in what combination of things. And as I mentioned, the things you want to look at is, well, how much does it cost, or how long am I going to be down, or how often do I have to do it, or how fast is this going to work? And beware if people are trying to sell you pie in the sky. If you're morbidly obese, a radio frequency device for fat treatment is not going to be effective in giving you the same thing as, a actual liposuction or actual surgical weight loss. So there are instances where, we have to be realistic in our expectations about what we want from these different treatments. Next slide. This is once again just some of the common names of some of the ones that you'll see out there. I have TempSure. There's one called, I guess, Picture. One for the muscle that's very popular is Emsculpt, for folks looking at what does a muscle laser device does. Well, one treatment is like doing 20,000 crunches. So anyone let me know, call me the last time you've done 20,000 crunches in one setting, and I'd love to meet you. But but that's what you're buying, is the ability to do 20,000 crunches in 1 hour from a device that is relatively safe. Or not relatively it is safe. Actually, I've tried it in conferences myself. It's pretty cool. Next slide. And this is just some attestments from the doctors that do these things. Next slide. this sounds scary. We love to talk about this Halloween vampire facials. Kim Kardashian, if any of you have ever heard of her, was popularized some years ago, being on TV, getting her vampire facial. And that's where we take the PRP blood from your body and we put it back onto your face. And then we do the micro needling. So, that's why it's the vampires from blood. And then, but at the end of it, you come out with a rich glow, a rejuvenated skin surface, reduced wrinkles. And not only is it good at the moment that you're doing it, but it's the gift that keeps on giving. So over the next 2 to 6 weeks, your skin just gets better and better and better. So, in case you've ever heard of what a vampire facial is, and those things you can find around, like I do them at my office, but they're pretty fun and cool to see what your own body can do for itself. Next slide. Every day there's something new. I love this new addition that we can do now. It's called a PRP butt lift. I had a young lady a couple of months ago that was flying to Florida to get the Brazilian butt lift, and she was explaining to me how she paid the airline to help her fly back on her knees and have her butt in the air, and all these types of things to get a butt lift surgically. Well, a PRP butt lift is where we inject your blood obtained from a PRP into target areas that we want to kind of lift and kind of mold for you. And then we can use our radio frequency device to help stimulate your elastin and collagen in those areas. And you don't even have to fly to Florida to get that done. Next slide. Okay. Mona Lisa, I'm just naming out a few things in case that you've heard of these in like common talk of, in your social circles. Mona Lisa is a type of laser treatment that ladies can get to restore their vaginal tissue. And some women are doing this for cosmetic reasons. Some women are doing it for incontinence. Some women are doing it to restore sexual pleasure. Some people are doing it to, decrease a condition called atrophic vaginosis. So it has both medical and cosmetic benefits, many medical ones that are quite beneficial. So a lot of ladies suffer in silence with these conditions because they don't think there's anything that can be done to help them. And now we know there are. Mona Lisa is just one example. Next slide. There are cool new options for doing like in-office liposuction. You can have fat taken out of one part of your body and put it in other parts. You could have it taken out of your butt and put in your lips. And you can do a lot of these things in 1 or 2 office sessions. That's not actually surgery. So if you're interested in those types of things, they are out there as well. Next slide. Pellets have been around for some time. A lot of my colleagues here in the area have been doing pellets for women, and that's where they take some of the vital sex hormones like testosterone, estrogen, and progesterone in both women and men, because women do have a need for some testosterone as well. And they put it in a little pellet, sort of like a piece of hamster food, or it looks like a piece of hamster food, and they implant it just under the skin there, and it slowly absorbs over time to provide those therapies for you. I was very happy to see the past year or two that now they've expanded pellets to be used more widespread in men as well. So I have men colleagues and men patients and stuff that are also getting pellet therapies, and it helps them, feel overall more healthful. It helps their sex drive, it helps their muscle tone, it helps their memory, it helps their sleep. So these things are not limited to just, in persons like, well, my sex drive is great, I don't need those things, but it really helps from a very holistic standpoint of view. Next slide. A thread lift, I'm just like I said, rather not new things that you may have heard of, but thread lift is pretty cool. It looks like where you take fishing wire and they thread it in parts of your jaw or your lip. And what it does is it creates, it makes the body think there's trauma there. So it actually helps to build up those areas. So you can, if you wanted a more square jaw, it can do that within several weeks, or, if you wanted your lips to look a little bit more pouty for an event, it can do that too. And the thread dissolves on its own. And, very little or no complications have been reported with these types of treatments. So, very good alternative to getting a surgical facelift. Next slide. And so I did a lot of talking. I do thank you and appreciate you. This is my information. I'm Dr. Adrienne Burrows, and this is my website and my office number and email. And I wanted to just kind of give an opportunity to really have more of an interactive discussion with any persons that have any questions or would like to talk more.
Dr. Burrows, this was absolutely great, fascinating. And I'm glad I don't have to go all the way to Brazil.
You're right, you don't.
I want to refer back to one of your other slides and then last Dr. Watts to comment that the death level of Black males and females not living as long as we used to. Tell me about those slides.
We're living
earlier.
Pardon me?
Is our lifespan longer or shorter now?
Oh no, our lifespan is definitely longer. It is much longer. And, and that is through, obviously there's probably many reasons, why we are living longer. To be quite frank, my own personal opinion is, I think if you look at life expectancy, as well as the availability of statin medication for the doctors on the call, there might be some correlation there. But, yes, no, we are living longer. I recall when I was a kid and I would look at my grandparents or older people and, oh, that's old grandma and stuff. And now that I'm an adult and realize, wait a minute, my grandma was old and she died when she was 72 and she had been old to me my whole life. And now, like, as I mentioned, a 60-year-old or 72-year-old is a young senior. So we are living longer, and with living longer, we want to look good and feel good along with living longer as well.
That's so great. Dr. Watts.
I'm still taking it all in, Dr. Maxey. Dr. Burrows, thank you so much. That's really an excellent, I was going to say excellent overview, but really you dug into a lot of opportunity for us to pay attention to how we can be that captain of the team, as you said, and take advantage. I wanted to ask you, a lot of times, especially in the past and going through my training in psychiatry, we would talk about when someone wanted to change their appearance, when someone wanted to get a lift here or a tuck there, maybe there was some mental health part of it going on. And so I wanted you to just talk a little bit about these folks that you're seeing and how any mental health screenings are done, and if you feel that there is a mental health component to some of the work that you do.
Oh, well, that is a great question. Well, in primary care, there is nothing we can do that is more beneficial mental health wise than a person actually seeing a professional like yourself and stuff. But unfortunately, access can be challenging, and we're sort of the gatekeepers. We're oftentimes lucky if we can even get the persons in the door, and so we're trying to catch as many persons as we can for you. And so as part of an annual healthcare screening for seniors that I typically do and many doctors do, and not just for seniors, is we'll do something called like the PHQ-9 and the PHQ-2, which is a mental health screening. Now, in terms of people in general just coming in for aesthetic purposes, probably if they're just going to say a laser location or cosmetic location. And this is why I say it's good having your primary care doctor in the loop on these things. They're not looking at that person's entire picture. So they're just providing a service to that individual. But in my own office, if this is a patient or client of mine and there are a few people, and I noticed that, wait a minute, you are spending a lot of time, money, and effort on some of these cosmetic or aesthetic things. It is an eyebrow raiser that, maybe this is a symptom of some other underlying, issues that we might want to address. And it is the opportunity to open up those discussions. On the other hand, we do also want to reduce the stigma, though, now to these treatments and opportunities that people are having to look good from the outside in, and let them know that there is no stigma now, that, this is, if men go to the haircut to get their, in fact, these days, young guys aren't getting a haircut. All the basketball players have long hair, but they're, as I mentioned, they're making sure they don't have wrinkles, so this is just becoming part of the, armamentarium of just generalized, hygiene and appearance and stuff. So the bar for doing these things is much, much lower, and doesn't necessarily represent, a self-esteem or other, mental issue. But as a primary care doctor, yes, if I had a person that seemed to be overindulgent in these things, particularly if they're doing it, with another thing patients will ask me is, doc, well, should I do this? Or, and not just about treatments, but just say even about herbal supplements. I'll generally, I'm pretty corny, and I tell patients, like, look, if you want to do supplements or something alternative, there's 3 things. If you think it's helping, if I know it's not hurting, and it's not breaking your bank, then go for it. But if it's any one of those things, then it's a red flag to probably not do that. And, and that's whether that's some treatment or herbal supplements as well.
Excellent. I'd like to know if there are any comments or questions from non-physicians on, we'll get to the doctor. We always have a mixture of lay people and doctors. But given your topic, I'd like to know if some of our non-doctor friends on the call would like to ask questions or make comments. No? Everybody is shy?
I think everybody is taking notes, Dr. Maxey, but
Well, I see
Dr.
a hand
Lawson,
raised, yeah.
Dr. Lawson has a question or
Dr.
comment.
Lawson, go ahead.
Yeah, I just want to note that we talk about the amount of money we do to look good, but we please remind people the impact of drugs of abuse on aging. It actually shortened the telomere, it worsens skin. So there's a lot of advertising to promote various kinds of addicting drug agents, but the reality is that what these folks are doing is actually shortening their life expectancy.
Very good point. Very good point. So none of our
no, we do, Dr. Maxey. Hazel Tanner has a hand up, and then Dr. Sherrod has a hand up.
All right. Hazel Tanner.
Okay, good. I know how to unmute. I have a question, Dr. Burrows, and my question, because I'm 77, and I'm concerned about my cholesterol, and since I made 70, the cholesterol has been going up. I don't eat a lot of food with high cholesterol. I scrutinize my diet. I exercise on a regular basis, and the last check was last year was 221. It went from 211 to 221. My doctor saying that it's okay. That's not okay for me. And I've increased oat growth. I mean, I use steel cut oats. I do flaxseed. I do chia seed. I drink flatter water. I drink lemon lime water. I do ginger and turmeric. I mean, and then I read recently that they were saying that because the estrogen level going down, it had somehow affects make the cholesterol rises. So how can I counteract that without going on Lipitor? I don't want to go on medicine for lowering cholesterol. So what do I do?
Great question. So and we have Dr. Sherrod also on the line, so I got to make sure I'm giving all the right information. So, we have to understand that, as our life expectancy is increasing, that our body is still naturally aging. And, we're at our peak cellular performance. Once again, like it or not, I didn't make the rules. We're at our peak cellular performance at about age 25 years old. And so after that, our body starts to, our cells undergo something called apoptosis over a period of time. And what we want to do is we want to slow that rate that is happening. So some of your cholesterol, you know, it's what you're putting in your body, it's what your body's producing, but let's not forget the genetic component. And unfortunately, that's not something that we can necessarily change. Now, it sounds like you're doing a great job with basically, you know, doing everything that you can externally to help keep your cholesterol low. And without, you know, statins are, you know, Mr. Statin or Mr. Merck or whoever's not my dad, but it is one of the best, you know, pharmaceutical treatments for cholesterol that there is, you know, hands down. But aside from that, I don't know. The other thing you could consider is make sure that you're adding supplemental fiber, you know, because it's not just what you're putting in your body, but let's take some things out of your body, and the fiber can try to can possibly, you know, draw out some of that cholesterol. And we have to be cognizant, and this is a discussion that you can have with your primary care doctor about when you look at your total of 220, this is where the cholesterol ratio may have some significant information for you, because if your HDL, your good cholesterol, is rising at the same time that your total cholesterol is rising, that total number could be reflective of actually the good things that you are doing. So, you know, it's not uncommon for patients with a really high HDL, which is what I want, the higher the better, to also have a high total. You know, it's like I use the analogy, you know, we all want to wear skinny jeans because we want to look good, but we'd rather have a pocket full of quarters than look skinny. So sometimes if you're filling those pockets full of good cholesterol, you know, your total is going to be overall a little bit higher, but that's because it's full of good things. And that may be more beneficial to you than having a lower total cholesterol with a lower HDL. So that's where the cholesterol ratio can be of some significant importance in interpreting your cholesterol profile overall.
And probably
HDL was good.
look at their levels of LDL and see how that fits into the ratio, and VLDL. So those are other numbers you might want to look at.
Okay.
Dr.
Yeah,
Sharad?
Dr. Sharad?
I'm just going to say, Dr. Sharad, I'm reading Dr. Blackstock's book, and she mentioned you in her book. I say, okay, I know this lady. You're a friend of our mother's.
Thank you so much, Ms. Turner. Wow, Dr. Burrows, that was outstanding. And I actually learned a lot. Where's your office now?
Oh, great. It's I'm located very conveniently right next door to St. John's Hospital in Santa Monica.
That's
so you-
right. That's right. She only treats seniors. You're too young.
Oh, no,
No, I
I'm a
don't.
senior.
Don't
I'm
listen to
definitely a-
him. Don't listen to him. My patients I see. You remember that Buzz Lightyear starting at age 14 to infinity and beyond.
Okay.
Oh, right.
So,
Well,
so-
actually, go
so if
ahead.
you're over 14, come on down.
Yeah, thank you so much. So I really did learn a lot, Dr. Burrows, from your presentation. And Hazel, Miss Tanner actually took my question because it was concerning cholesterol. I don't tolerate the statins. And also, can you speak a little bit about cholesterol and chronic infections? Because I've been reading that with chronic infections, your cholesterol will be a little higher because you need cholesterol to do the repair work. So can you speak a little bit on that? And also the question on screening for cervical cancer. I've heard of several of my colleagues and other people, older women dying from uterine cancer. And so what's the recommendation for picking that up if you're not doing the cervical cancer screening? Are they still getting the pelvic exam once a year and you're supposed to pick it up that way? Or?
So good couple of questions. So I'll start with some of the first part of your questions in terms of the relationship between the cholesterol and the chronic infections. It's probably more than can just be kind of in a snapshot. You really would probably have to look more in depth to it, but something that is good for cholesterol as well as reducing the incidence of infections would be like a omega-3, you know, or flax oil supplementation. I also am really a big fan of zinc and all the wonderful things that zinc can do in the body. Now, this is not just going to be a one a one thing will fix everything, but that definitely can help both cholesterol as well as, the incidence of chronic infection. And then regarding the Pap smear recommendations. Now, it's interesting that you say, many women who have died of uterine cancer, because in in all the years I've practiced, I don't think I've seen 10 women die of cervical cancer, or even hardly get diagnosed with cervical cancer if they are born. And the persons I've seen typically that are diagnosed and expire from cervical cancer, unfortunately, are ladies who are new to the American healthcare system, maybe have fallen out of healthcare for whatever reason. Life happens, you don't have insurance, you don't see your doctor for several years and stuff. And so part of I'm a skeptic at heart. And so whenever the guidelines change on the cancer screenings, I too have to ask myself, well, is this just American healthcare, being cheaper? Is there some sound science behind these new changes? So the new changes in changing the Pap smear screenings from age 65, from age 25 to 65, as opposed to earlier and later. There actually is some sound data and science surrounding that. Cervical cancer, if you're getting screened as you should be, there's so many opportunities for cervical cancer to be picked up from the time a person has a normal cervix to the point where it will be something cancerous. And the reason why the guidelines changed is that when we ask ourselves, well, why were we ever testing women once a year with Pap smears in the first place? And the reason is that, it's just like, oh, well, that sounds good, but now we live in an age of what's called evidence-based medicine. And we see that, if we look at, well, how many cancers were we detecting in checking women once a year compared to checking them every 2 years? And we realized that there wasn't much difference. And then they expanded to all of checking them once a year or every 3 years, and there wasn't much of a difference. And so now they have now expanded that to 5 years. And so we're using evidence-based medicine data to really let us know that we didn't have to do Pap smears that frequently, one. Two, we also know that, part of in medicine, we want to also do no harm. Many women over the years, you talk about hysterectomies and colposcopies, and there's been a myriad of procedures, invasive procedures done on women over the years because of abnormal Pap smears. And that's because when they were doing the screening starting in late adolescence and early 20s, it's not uncommon for women to have abnormal Pap smears, and they would get an invasive procedure to treat those things. Well, now we know that had we just waited till they were 24, 25, many times the body would have healed and repaired those things on its own. So moving the age to 25, and we're not doing yesterday's Pap smear. So today Pap smears, we're checking at the DNA level, we're checking HPV. So it's not the same Pap smear test that we were doing 30 years ago as well. So the tests are more informative. So therefore, waiting the 5 years between Pap smears, and I hate to be the bearer of bad news, but they're really considering kicking Pap smears out altogether. The technology is there, and having women do like a self-home swab, but they just haven't rolled it out to John Q. Public as of yet. But you bring up a good point, though, in that, I think it's going to be a 2 steps forward, 1 step back phenomenon, in that whereas we may not detect any more or less cervical cancers than we did previously, we are going to miss the opportunities if women are not going to be having these tests to catch other things that doctors may have oftentimes picked up on just by doing that pelvic examination at that time. And I do too anticipate that there will be some kind of having to redact or adjust to what will so it won't necessarily be a cancer screening, but what type of examination schedule, a pelvic examination schedule, will we have to modify to? Women, ovarian cancer sometimes is confused with uterine cancer, and it is typically far more deadly than uterine cancer, and there are not good screening tools at this time around for ovarian cancer. So we have to, parse out sometimes if it, was it uterine cancer or ovarian cancer, or, exactly. But I don't know if that helps, but so I would suggest, get your Pap smear every five years, get your visit with your PCP once a year. And if he or she, feels that it's good for you to go ahead and still do a pelvic exam, then that would be something that you're always entitled to be able to do.
Doctor, thank you. This has been an outstanding presentation. We're at the top of the hour. I just want to pose one more question I thought you did excellent on, and that is looking at people's medications. In my own case, I noticed that I was walking kind of slow with my son last week. And I couldn't figure out because I work out fairly frequently. And I looked at my eye drops last night and they had a beta blocker in them. So it was slowing down my heart. As soon as I got rid of that, my energy came back. So I think it's very important, like you said, that people bring in their bag of medicine and let you look at it and reconcile it. You want to just comment on a minute before we ask for final comments? Dr. Burrows?
Oh, I'm sorry. I thought you were asking the question to the audience. I apologize.
No, I was just commenting on the fact that you thought it was a good idea.
Oh, no. I think it is, preventing illness and disease is so much more rewarding sometimes than even treating it. And believe it or not, doing something as simple as reconciling the medications. I have patients that are on, they might be on two different beta blockers because, one was prescribed by the ER and one by their other doctor, and they not even realize that they're the same exact medicine, but one's a brand name and one's a generic and stuff. And that's why it's so important to just have those. And the electronic medical records are always fraught with error. They, at the end of the day, they're a tool, they're a machine. Our patients think, well, hey, that machine is going to do the job, but those are humans that are inputting that data. And humans still are, prone to have error and stuff. And I have to caution, counsel, and reprimand my own staff over and over again when I can tell that they've just asked the patient, hey, is everything the same? And they click enter, and next thing you know, there's a bunch of misinformation year after year. Oh, and by the way, the local pharmacies like CVS and those places are on autopilot and robo-dial. So, you can have a medicine that a doctor gave you 10 years ago, and CVS may still call you every 60 days and say, hey, we have your medication refill. So we have persons that are going to the doctors thinking that their doctors have ordered them or are keeping them on these medications. And it's just the pharmacy is just auto-dialing people, and people don't know that they're even on medications that the doctor doesn't want them on anymore.
Well, thank you so much for being our guest and today, and I want to wheel a commitment from you to come back and teach us again soon.
Oh, sure. No problem. I love it. And it's great to see old names and faces and new ones as well.
Well, thank you. Dr. Walk, final words?
Thank you, Dr. Maxey. I just want again to thank you, Dr. Burrows, for an excellent presentation and really getting into a lot of the different strategies that folks may not know about, that may not be common conversation in many of our communities about these ways to augment and enhance how we're thinking the world sees us. So I think it's a wonderful opportunity. And I just want to emphasize one thing you said. Our former colleague, the late, great Dr. Wilbur Jordan, would always talk about the importance of us having a primary care doc and about us seeing our primary care doc regularly. So whoever that person is that is going to be the quarterback for your medical team, it's important to make sure that person knows you and knows what you're doing. So put those meds in a bag and bring them to the doctor's office, no matter how big the bag needs to be.
Exactly.
Carry that bag in.
Well, thank you so much. Everybody have a great, great Sunday. And Simon, thank you again so much. Have a great Sunday. Bye-bye.
Good day,
Bye-bye.
everyone.